one of the things that I started thinking about when you first kind of presented this was just kind of the context of psychotherapy and you know, how enacted racism in psychotherapy creates a rupture, right, in the therapeutic relationship and alliance. It disrupts the therapy process. It threatens trust. It increases the likelihood of client termination. It compromises the ability to deliver effective services, and most importantly, it can harm the client. So we need to really, you know, pay close attention to the ways that racism is enacted in the therapeutic context. And of course, that means being centered in anti-racism practice in psychotherapy, which, you know, I think about that like it takes a variety of forms, right? So an anti-racism orientation in psychotherapy, we want to think about that in terms of prevention, right? So what can the therapist do to try to lessen the likelihood of these enacted racism ruptures? We want to think about repair and recovery, because inevitably, you know, things land how they land, and you know, we're all in process with learning how to really be a therapist that is firmly grounded in anti-racism practice. So there's going to be ruptures, but the other piece of anti-racism work is the acknowledgment, right? The naming and the repair and recovery. And then I think the other couple of pieces are more systemic, right? So racism is clearly a systemic process that expresses itself in many ways, individually, internally, interpersonally, but it is fundamentally a systemic process. And so, you know, anti-racism practice also involves attention to advocacy and also to systemic change. So what's embedded in our theories? What's embedded in our psychotherapies, in our training? Right? What's going on with access to services?
Absolutely.
You know, and how does this ideology of white supremacy and Eurocentric bias show up in our theories and our practices? So we need to kind of unpack our systems of psychotherapy. But what I want to maybe focus a little bit more on today is mindfulness as a tool in having an anti-racism orientation to psychotherapy, and with an emphasis on prevention, right? Because we don't have all the time in the world, right? With an emphasis on prevention.
On the front end.
Right? How can we help therapists maybe reduce the likelihood of ruptures occurring?